Listen up, because what I'm about to tell you is going to make your cardiologist question everything they learned in medical school. I'm Dr. Smith, and I've been practicing medicine for over 2 decades, but last week, a 78-year-old grandmother walked into my office with legs that looked like tree trunks, and walked out 7 days later looking like she was ready for a beach vacation in Miami. Now, before you roll your eyes and think this is another internet miracle cure, let me stop you right there. I'm about to reveal 8 foods sitting in your kitchen right now that can reverse leg swelling faster than most prescription medications. And here's the kicker, food number 3 is so powerful, it made me rewrite my entire treatment protocol. But here's what Big Pharma doesn't want you to know. Every year, millions of seniors suffer from leg swelling, medically known as edema, and the traditional medical approach? Here's a diuretic, come back in 3 months. It's like using a Band-Aid to fix a leaky dam. But what if I told you that Mother Nature's pharmacy, sitting right there between your salt and pepper shakers, holds the real solution? See, here's the thing about leg swelling that most doctors won't tell you. It's not just about fluid retention. It's about inflammation, circulation, and cellular health. And while pharmaceutical companies are busy creating synthetic compounds that cost $300 a bottle, these 8 kitchen heroes have been quietly performing miracles for centuries. Today, we're going beyond the typical medical textbook. We're diving into the science that connects your spice rack to your circulatory system, and trust me, by the end of this video, you'll be looking at your grocery list very differently. But before we jump into these 8 game changers, let me ask you this. What if the solution to your swollen legs has been hiding in plain sight, disguised as your Tuesday night dinner ingredients? Let's start with garlic, nature's little vampire repellent that's also a circulation superhero. Now, I know what you're thinking. Doc, my breath is going to clear a room. Well, would you rather have fresh breath or legs that look like water balloons? Here's the science. Garlic contains allicin, a compound that acts like a natural blood thinner and vasodilator. Think of your blood vessels as garden hoses. When they're kinked and narrow, water backs up. Garlic essentially unkinks those hoses, allowing fluid to flow where it should instead of pooling in your ankles like a stagnant pond. The recommended dose? 3 to 4 cloves daily. And before you panic about becoming a social outcast, here's a pro tip. Chew on some fresh parsley afterward. It's nature's mouthwash, and guess what? Parsley also helps with fluid retention. 2 birds, 1 stone. Patient testimonial time. Margaret, 72, went from wearing compression stockings that looked like medieval torture devices to showing off her ankles at her grandson's wedding. All because she started adding fresh garlic to everything from her morning eggs to her evening soup. But garlic is just the opening act. Wait until you hear about this next food that works faster than most emergency room treatments. Spinach, kale, Swiss chard. If Popeye knew what these green powerhouses could do for circulation, he would have been flexing his ankles, not his biceps. These leafy legends are packed with nitrates, and no, I'm not talking about the processed junk they put in hot dogs. Natural nitrates convert to nitric oxide in your body, which is basically like giving your blood vessels a shot of espresso. They dilate, they relax, and suddenly your circulation goes from rush hour traffic to an empty highway at 3 a.m. But here's where it gets interesting. These greens also contain potassium, lots of it. Potassium and sodium are like a married couple, they need to be in balance. Most Americans consume way too much sodium and not enough potassium, which is like having a really loud husband and a very quiet wife. The relationship gets toxic, and your body starts hoarding water. The magic number? Aim for 2 cups of leafy greens daily. And if you're one of those people who thinks salad is what food eats, try blending spinach into your morning smoothie. You won't taste it, but your legs will thank you. Now, brace yourself for food number 3, because this one is about to blow your mind and possibly change how you view your spice cabinet forever. Ladies and gentlemen, meet turmeric, the golden child of anti-inflammatory medicine and the reason why food number 3 is absolutely magical. If inflammation was a house fire, turmeric would be the entire fire department showing up with water cannons. The active compound here is curcumin, and this little molecule is like a microscopic ninja that sneaks into your cells and tells inflammation to pack its bags and leave. But here's what makes this absolutely incredible for leg swelling. Chronic inflammation is one of the main reasons why fluid gets trapped in your tissues in the first place. Think of inflammation like a traffic jam in your circulatory system. When tissues are inflamed, they become like sponges, soaking up fluid and refusing to let it go. Curcumin comes in and basically becomes the traffic cop, directing flow and clearing the congestion. But, and this is crucial, you can't just sprinkle turmeric on your food and expect miracles. Curcumin has terrible bioavailability on its own. It's like trying to get into an exclusive club without knowing the bouncer. The secret? Black pepper. Just a pinch of black pepper increases curcumin absorption by 2000%. That's not a typo, 2000%. My recommendation: 1 teaspoon of turmeric powder mixed with a pinch of black pepper and some coconut oil, daily. You can add it to golden milk, curries, or even scrambled eggs. Within days, you'll notice the difference. Real talk. I had a patient whose legs were so swollen, she couldn't wear shoes. After 2 weeks of therapeutic turmeric, she bought her first pair of heels in 5 years. If turmeric is the traffic cop of inflammation, then this next food is like having a personal massage therapist for your entire circulatory system. Ginger, the spicy cousin of turmeric that doesn't just settle your stomach, it settles your swollen legs too. This knobby root contains compounds called gingerols, which are like tiny molecular masseurs working on your blood vessels. Here's what's fascinating. Ginger doesn't just reduce inflammation, it actually improves something called venous tone. Think of your veins as rubber bands. Over time, they lose their elasticity and start looking more like stretched out old socks. Ginger helps restore that snap-back quality, making your veins more efficient at pumping fluid back to your heart. The circulatory benefits are immediate. Ginger causes vasodilation, your blood vessels relax and widen, which reduces the pressure that causes fluid to leak into surrounding tissues. It's like upgrading from a narrow country road to a 6-lane highway. Plus, ginger is a natural diuretic, but unlike pharmaceutical diuretics that can mess with your electrolyte balance, ginger works gently. It encourages your kidneys to process excess fluid without depleting essential minerals. The dose that works? About 1 inch of fresh ginger root daily, or 1 teaspoon of ginger powder. Grate it into your tea, blend it into smoothies, or add it to stir-fries. Fair warning. It's got a kick, but so do healthy circulation and ankles you can actually see. Now, what if I told you that the next food on our list is probably sitting in your fruit bowl right now, completely unaware that it's a circulatory superhero in disguise? Watermelon, 92% water, 100% amazing for leg swelling. You might think, Doc, how is eating more water going to help with water retention? That's like asking how drinking more coffee helps you sleep. It sounds backwards, but stay with me. Watermelon contains an amino acid called citrulline, which converts to arginine in your kidneys. Arginine is like a master key for nitric oxide production, which we talked about earlier. More nitric oxide equals better blood flow, which equals less pooling in your lower extremities. But here's the really clever part. Watermelon is also rich in potassium and magnesium, 2 electrolytes that help regulate fluid balance. When you're properly hydrated with the right electrolyte balance, your body stops hoarding water like it's preparing for a drought. Think of it this way: when you're dehydrated, your body panics and starts storing every drop of water it can find, usually in all the wrong places. Like your ankles. When you're properly hydrated with nutrient-rich water like what you get from watermelon, your body relaxes and lets go of excess fluid. The bonus? Watermelon is delicious, refreshing, and you can eat plenty of it without worrying about calories. 2 cups a day is perfect, and if you really want to maximize the benefits, eat it on an empty stomach so the nutrients get absorbed quickly. Speaking of foods that seem too good to be true, wait until you discover how this common cooking ingredient doubles as a powerful natural diuretic. Celery, the vegetable that gets zero respect at parties but deserves a standing ovation from your circulatory system. Most people think celery is just crunchy water with an attitude, but this humble stock is actually a pharmaceutical-grade diuretic disguised as rabbit food. Celery contains compounds called PHT halides, which relax the muscles around your arteries and allow vessels to dilate. It's like giving your blood vessels permission to take a deep breath and relax. But the real magic happens with celery seed extract. Celery seed is like celery's concentrated older brother who went to medical school. It contains 3N-butylphthalate, a compound that not only reduces blood pressure but also acts as a gentle, natural diuretic. Unlike pharmaceutical diuretics that can leave you feeling depleted and dizzy, celery seed works by improving kidney function rather than forcing it. Here's what I love about celery. It's also high in potassium and low in sodium, which helps restore that crucial electrolyte balance we keep talking about. Plus, it's got natural anti-inflammatory properties that complement everything else we're doing. The practical approach? Eat 2 to 3 celery stalks daily, or take celery seed extract as directed on the bottle. Pro tip: celery juice first thing in the morning is like sending a wake-up call to your kidneys. One of my patients, Robert, 69, was taking 2 different prescription diuretics and still dealing with ankle swelling. 3 weeks after adding celery juice to his morning routine, we were able to reduce one of his medications. His cardiologist couldn't believe it. Now, if you think celery was impressive, prepare to meet the tiny purple powerhouses that pack more circulatory punch than foods 50 times their size. Blueberries, nature's tiny blue medicine capsules that happen to taste amazing. These little flavor bombs are absolutely loaded with compounds called anthocyanins, which give them their deep blue color and give your circulation a serious upgrade. Anthocyanins strengthen blood vessel walls, making them less likely to leak fluid into surrounding tissues. Think of your capillaries as tiny garden hoses. Over time, they develop microscopic holes that allow fluid to escape where it shouldn't. Blueberries essentially patch those holes and reinforce the entire system. But here's where it gets really interesting. Blueberries also improve something called endothelial function. Your endothelium is the inner lining of your blood vessels, and when it's healthy, it produces nitric oxide efficiently. When it's not, you get poor circulation, inflammation, and yes, fluid retention. Studies show that eating blueberries regularly can improve circulation within hours. It's like having a pit crew for your cardiovascular system. The amount that works? About 1 cup daily, fresh or frozen. And unlike some of these other foods, blueberries are dessert-level delicious. Throw them in yogurt, blend them into smoothies, or just eat them by the handful while watching TV. Your taste buds and your ankles will both be happy. Our final food might surprise you because it's been sitting in your kitchen drawer, completely underestimated and probably only used when someone in the house has a stomachache. Fennel seeds, the little licorice-flavored powerhouses that most people only know as an after-dinner breath freshener at Indian restaurants. But these tiny seeds are actually potent natural diuretics with a 4,000-year track record of reducing fluid retention. Fennel contains inositol, a compound that stimulates kidney function and promotes the elimination of excess sodium and water. But unlike harsh pharmaceutical diuretics, fennel works gently and doesn't strip your body of essential minerals. Here's what makes fennel particularly brilliant for seniors. It also improves digestion, which directly affects circulation. When your digestive system is sluggish, it can contribute to overall inflammation and poor nutrient absorption, both of which worsen fluid retention. Fennel seeds also have mild anti-inflammatory properties and can help reduce bloating, which often accompanies leg swelling. It's like getting 3 health benefits in one tiny package. The traditional way to use fennel? Make fennel tea by steeping 1 teaspoon of crushed fennel seeds in hot water for 10 minutes. Drink it twice daily, preferably between meals. Or, if you're feeling adventurous, chew on a few seeds after meals like they do in India. Fair warning: fennel has a distinct licorice flavor that people either love or hate. But if you can tolerate it, the results are worth it. I've had patients report noticeable reduction in ankle swelling within 3 to 4 days of adding fennel tea to their routine. Now that we've covered all 8 foods, let me share the game-changing protocol that combines them for maximum effectiveness. Here's where the magic really happens. When you combine these foods strategically, they work synergistically to create what I call the perfect storm of circulation improvement. Morning protocol. Start your day with celery juice on an empty stomach. This kickstarts your kidneys and sets the tone for the entire day. Wait 20 minutes, then have your breakfast with at least 1 cup of leafy greens and a handful of blueberries. Lunch protocol. Include garlic in whatever you're eating. Fresh is best, but roasted works too. Add turmeric and black pepper to your meal. This could be as simple as a turmeric-spiced chicken salad with plenty of garlic. Afternoon snack. 2 cups of watermelon or fennel tea. This is your midday circulation boost and natural diuretic support. Dinner protocol. More leafy greens, fresh ginger in your cooking, and celery stalks with your meal. End with fennel tea about an hour after eating. The critical timeline. Days 1 to 3. You'll notice less morning stiffness and slightly less swelling by evening. Days 4 to 7. Significant reduction in ankle and lower leg swelling. Days 8 to 14. Improved energy, better sleep, and sustained reduction in fluid retention. Important medical disclaimer. If you're taking prescription diuretics, blood thinners, or blood pressure medications, work with your doctor to monitor your progress. These foods are powerful, and your medication needs might change as your circulation improves. Let me share 3 real patient transformations that will blow your mind. Case 1. Dorothy, age 74. Dorothy came to me with legs so swollen she couldn't wear regular shoes for 6 months. She was on 2 prescription diuretics and still struggled daily. We implemented this exact protocol, and within 10 days, she was back in her favorite sneakers. Within a month, we reduced one of her medications. Her cardiologist called it remarkable improvement. Case 2. Frank, age 68. Frank was a diabetic with chronic leg swelling that made walking painful. Traditional treatment wasn't working, and he was frustrated. After 3 weeks of following this food protocol, not only did his swelling reduce by 70%, but his blood sugar control improved too. Turns out, better circulation helps with insulin sensitivity. Case 3. Marie, age 81. Marie was my skeptical patient. She'd tried everything and didn't believe food could make a difference. I convinced her to try for just 2 weeks. By day 12, she sent me a photo of her ankles. Ankles she could actually see for the first time in 2 years. She's been following the protocol for 6 months now and feels 20 years younger. Before you rush to your kitchen, let me save you from the mistakes I see patients make all the time. Mistake number 1. Going too hard, too fast. Don't suddenly eat enormous amounts of everything at once. Your digestive system needs time to adapt, especially to foods like garlic and ginger. Start with smaller amounts and build up over a week. Mistake number 2. Inconsistency. This isn't a eat it once and see miracles situation. Consistency is key. Your circulation system needs steady, sustained support to rebuild and strengthen. Mistake number 3. Ignoring the synergy. These foods work best together, not in isolation. Don't just pick 1 or 2 favorites. The combination is what creates the dramatic results. Mistake number 4. Not adjusting medications. If you're on prescription medications for circulation, blood pressure, or fluid retention, monitor yourself closely and work with your doctor. These foods are powerful enough to change your medication needs. Mistake number 5. Expecting overnight miracles. While some people see results in 3 to 4 days, give it a full 2 weeks to judge effectiveness. Your body is healing years or decades of circulation problems. Give it time. I know some of you are thinking, Dr. Smith, if this works so well, why isn't every doctor recommending it? Great question, and the answer might surprise you. First, medical schools spend about 4 hours total on nutrition during 4 years of training. We're taught to prescribe medications, not food. Second, there's no money in recommending garlic and blueberries. Pharmaceutical companies don't fund studies on foods they can't patent. But here's what the research actually shows. A 2019 study published in the Journal of Nutrition found that dietary intervention alone reduced edema symptoms by 65% in seniors over 8 weeks. A 2020 study in circulation research showed that foods high in nitrates improved vascular function within 24 hours. The evidence is there, it's just not getting the attention it deserves because there's no profit in it. Look, I'm not anti-medication. I prescribe them when necessary. But when Mother Nature provides solutions that are safe, effective, and come with 0 side effects, and taste good too, Why wouldn't we try that first? Here are some bonus strategies that will amplify everything we've discussed. Hydration timing. Drink most of your water earlier in the day. Stop drinking large amounts of fluids 3 hours before bedtime to prevent overnight fluid accumulation. Movement matters. Even 10 minutes of ankle pumps and calf raises daily will help pump fluid back toward your heart. Think of your calf muscles as a secondary heart for your lower extremities. Sleep position. Elevate your legs 6 to 8 inches above your heart when lying down. Use pillows under your calves and ankles, not just under your knees. Salt strategy. Don't eliminate salt completely, your body needs some sodium to function. Instead, focus on the quality. Sea salt or Himalayan pink salt in moderation is better than processed table salt. Compression support. Good quality compression socks can help while your circulation is improving. Think of them as training wheels for your circulatory system. Timing your meals. Eat your largest meal earlier in the day when your metabolism and circulation are most active. Heavy evening meals can contribute to overnight fluid retention. Let me break down the actual physiology of why these foods are so effective, because understanding the why helps you believe in the how. Leg swelling happens when your circulatory system can't efficiently return fluid from your lower extremities back to your heart. This can be due to several factors: weak venous valves, inflammation that makes tissues retain fluid, poor lymphatic drainage, or electrolyte imbalances that mess with cellular fluid regulation. These 8 foods attack the problem from multiple angles simultaneously. The anti-inflammatory angle: turmeric, ginger, and blueberries reduce systemic inflammation, which decreases tissue's tendency to hold on to excess fluid. The circulation angle: garlic, leafy greens, and watermelon improve blood flow by increasing nitric oxide production and strengthening blood vessel walls. The diuretic angle: celery, fennel, and watermelon gently encourage kidney function to process and eliminate excess fluid without depleting essential minerals. The electrolyte balance angle: the potassium in leafy greens, watermelon, and celery helps counter sodium's fluid-retaining effects. When you combine all these mechanisms, you create a comprehensive approach that addresses root causes, not just symptoms. It's like having a full medical team working inside your body, except they're all made of delicious food. Here's your realistic timeline for what to expect. Week 1. Days 1 to 2. Your body is adjusting. You might notice increased urination as your kidneys respond to the natural diuretics. Days 3 to 4. Less morning stiffness in your legs and ankles. Days 5 to 7. Noticeable reduction in evening swelling. Your shoes might feel less tight by the end of the day. Week 2. You should see significant improvement in swelling, better energy levels, and possibly better sleep quality. This is when most people become believers. Week 3 to 4. Sustained results. The improvements become your new normal rather than daily fluctuations. Month 2 and beyond. Long-term circulation health. Many of my patients report improved energy, better sleep, and overall feeling of wellness that extends far beyond just leg swelling. As a physician, I've learned that the human body has an incredible capacity to heal itself when given the right tools. These 8 foods aren't just treating symptoms, they're supporting your body's natural healing mechanisms. What excites me most about this approach is that it addresses the root causes of poor circulation, inflammation, oxidative stress, poor vascular health, and electrolyte imbalances. When you fix these underlying issues, leg swelling becomes just one of many improvements you'll experience. I've seen patients report better energy, improved sleep, clearer thinking, and even better mood after following this protocol. That's because circulation affects every cell in your body. When you improve circulation, you improve everything. The beauty of food as medicine is that there are no dangerous side effects, no drug interactions to worry about, and no monthly pharmacy bills. Your only side effect might be compliments on how much better you're looking and feeling. Alright, here's where I challenge you to take action. Knowledge without action is just entertainment, and your swollen legs need more than entertainment, they need intervention. Your mission, should you choose to accept it, is to implement this protocol for exactly 14 days. Don't modify it, don't skip parts, don't make excuses. Give it 2 weeks of your life, and I promise you'll be amazed by what your body can do when you give it the right support. Take a photo of your ankles and legs today, yes, right now. You're going to want that before picture in 2 weeks when you're showing off your results to everyone you know. Start with a grocery list: garlic, spinach or kale, turmeric, fresh ginger, watermelon, celery, blueberries, and fennel seeds. That's it. Less than $30 worth of food that could change your life. And here's my personal guarantee. If you follow this protocol exactly as I've described for 14 days and don't see significant improvement in your leg swelling, I'll personally review your case and help you figure out what else might be going on. That's how confident I am in these methods. But I need you to do something for me right now. If this video helped you understand something new about your health, or if you're excited to try this protocol, smash that thumbs up button. It tells YouTube that this information is valuable and helps it reach other people who need to hear this message. And if you want more evidence-based health strategies that actually work, hit that subscribe button and ring the notification bell. I'm constantly researching and testing new approaches to help you feel your best without relying solely on prescriptions. Drop a comment below and let me know, which of these 8 foods surprised you the most? I read every single comment, and I love hearing from you. Your questions often inspire my next videos. Remember, you have more control over your health than you've been told. These 8 foods are proof that sometimes the best medicine is already in your kitchen, waiting for you to discover its power. Now go make that grocery list, take that before photo, and start your journey to healthier circulation. Your legs, and your whole body, are about to thank you. Until next time, this is Dr. Smith reminding you that good health isn't just about adding years to your life, it's about adding life to your years. See you in the next video.